good evening, and welcome to Couch Conversations with the Doctors, where health is wealth. What night is it tonight? It is Monday night, and it is time for Couch Conversations with the Doctors. Well, Dr. Miller, I'm going to let you take over and introduce everyone, and I'll be back. Go right ahead.
All right. Good evening, everybody. I'll first introduce myself. I'm Dr. James Miller. I am a retired internist. I retired in 2019 after practicing 40 years. Really, at one point in time, I probably were practicing all over the city. I practiced for a while on the south side, north side, western suburban areas. But my main focus and most of my time was spent on the west side and in the western suburbs. But I did practice in the other communities as well. And so, so that's it for me. I'm retired from the general practice of medicine, but I'm still interested in looking at and doing what we can to make certain that our community is as healthy as possible, and looking at finding and helping in finding solutions to the care and services that the people of our community needs. And so I'm going to go ahead and ask my colleagues to introduce themselves. We'll start with Dr. Graham. Dr. Graham.
Thank you, Dr. Miller. I'm like you. I'm a retired physician. I worked in the western suburbs of Chicago for 30 years. I then joined the congressman in his office. And boy, did I learn a lot about public health and public service and politics. It was an eye-opening experience. I wouldn't trade it for anything. And I'm going to try and answer your questions as best I can.
All right. Terrific. Dr. Hampton?
Definitely happy to be here. We appreciate Congressman Danny Davis, Nikki, for leading us with this platform. I'm a family and obesity doctor on the south side of Chicago. Grew up on the west side and took my services to the south side, but don't take it personal if you're a west sider. I still love you guys. I've been in practice for 30 years now, which is amazing to imagine. And I love every day of it. I love helping people, and always interested in helping people, have awareness that they have a lot of control of their destiny. So if that sounds like you, trust me, you have all that power. So we're here to guide you, walk with you, and even learn from you. I learn a lot from my patients, and I'm always excited to join this platform. So thank you for the opportunity, and let's chat it up a little bit.
All righty. Well, we were kind of talking before we came on, Dr. Graham and I and myself, and we were just, talking about the situation with the closing of West Suburban Hospital, and just looking at the fact that this is just one of the hospitals that is having financial difficulty in our city and in some of our surrounding areas. And, so we really want to kind of talk about how it's going to impact the services, the needed service that the people of the community need, and also looking at ways or things that we are going to really need to look at. I think we might come to a time when we may have to reimagine the delivery of acute care medicine. The large institution, they're not always efficient because they're big, gigantic facilities that take a lot to run, take a lot of folks to run it, and so sometimes I think that the care is needed. That has not gone away. However, the way that we deliver it and the facilities that we utilize to deliver it, it may need to be looked at and to reimagine and to figure out maybe some better ways and better kinds of facilities that can do this in a more efficient manner than maybe some of the facilities that the way things have been going in the past. So, just going to throw this out and maybe get your opinion. Like I said, I've been sort of involved a little bit in terms of trying to get West Suburban open, because as I get around and listen to people, I'm hearing people saying something happened to me and I'm 5 minutes away from West Suburban, but now I'm having to seek a hospital in another area, and like someone who'd had a seizure, and it took them a little bit longer to get to that hospital as opposed to where they're accustomed to going. And these kinds of things, or someone have a stroke or a heart attack, things that requires immediate attention, the lack of those facilities being available to people um, create hardships. And so we really need to look at, like I said, I'm working on trying to pull together the community and make certain that the people that have some authority look at what can do to, at least temporarily or for the time being, to get that facility open, but also to maybe start looking at new ways to deliver acute care medicine in some of these communities that where resources are not plentiful, and figuring out better and more efficient ways to do that would be something that I think is worthwhile studying.
Yeah.
So I'll step aside and listen to what my colleagues have to add to this idea.
Well, I'll chime in real quick. I just took a trip to Mississippi with my wife, her family. I think her mom grew up in Utica, Mississippi, and that's just below Jackson, Mississippi. And just below Utica is Port Gibson. And one thing you immediately notice is that the opportunities to receive health care in a way that we're used to is not as robust.
Yeah.
And I'm sure they do the best they can. But, and then you end up in a place like Chicago where we probably, get world-class healthcare. You end up in that area where Rush and the other hospitals are kind of bundled together. And sometimes you don't appreciate what's in your own backyard. Now, as a resident of Oak Park and someone who grew up literally on Austin and Adams, so I was in the Austin community, and as somebody that did a residency at West Suburban Hospital, I think we take for granted what we have when we have it. And for me, I'm just thinking about echoing what you just mentioned, Dr. Miller. If I had a patient recently who actually was fortunate enough to get to the hospital in time for a clot busting medication for a stroke.
Mm-hmm.
And the last thing you need to be doing when you're having symptoms of a stroke is trying to figure out, where can I go? And honestly, you may even come to the doors of West Suburban not realizing it's closed. It's like, it's scary. So yeah, rather it's a heart attack, stroke, an asthma attack. Asthma attacks are very time sensitive.
Mm-hmm.
And we need to have we need these things near our home because there's not a lot of time at all. So I think it's not just impacting the people who are trying to get care, it's even impacting. Last time we went to a local hospital, we went to Oak Park, Rush Oak Park, right? So imagine what's happening to Rush Oak Park right now.
Yeah,
I don't want to know what their emergency room looks like. So now you're gonna, put a lot of stress on the teams there. You're gonna have a lot of people who come there who are gonna be frustrated.
mm-hmm.
And that's because maybe they would have stopped at West Suburban if the doors were still open. So it's really it's a problem. And I just think that it's not just like the emergency care. That's what we think about with hospitals, but honestly, hospitals have clinics in them.
Yeah.
Right? In fact, Dr. Springer, one of the eye doctors who may not be out in the area anymore, but
he's still there. As a matter of fact, this past summer he did cataract surgery.
Really? We're seeing
did it at West Suburban.
Really? There you go. So
yeah.
What's Dr. Springer going to do? A very well-known ophthalmologist who I remember working with him, and I remember using that high magnification equipment to look at the retinal arteries, and I promise you, I think I saw red blood cells floating by. It was like watching, something, animation. But And I now understand, why you can diagnose things with the ophthalmology equipment, because that's one of the rare places you can look directly at a red blood, a blood vessel.
Mhm.
But so I trained at West Suburban. So
Yeah.
and truth be told, many people don't realize it. When Dr. Loafman was there, he started he was integral in the residency program. It was one of the few places in the country where family doctors like myself would learn how to do C-sections and tubals and DNCs.
Mhm.
And the sort of training ground for West Suburban Hospital. I literally had resident colleagues who were from Yale, Harvard, places like that, because it was so highly regarded.
Yeah.
So where are we going to train our doctors? Dr. Hampton was trained at this small community hospital, and it's a really good place to train, because as a family doctor, you really want to get your hands wet. What you don't want to do as a family doctor is be in a large teaching hospital, because you'll never do anything.
Right. Yeah.
They got a specialist for a toe, they got a specialist for an ear, they got a so as a family doctor, you want to get your hands wet, because that's a different type of specialty that really requires that, because you may end up in rural Illinois somewhere and be the only doctor, maybe one of two doctors. So you need to know how to do a lot of stuff.
Right.
And that's one of the reasons why. So and as we think about this, there's so many like downstream effects of a hospital closing that it blows my mind as I'm reflecting now. I just can't imagine what that means downstream. Even the residents who are currently there, where did they go?
Yeah.
And will they get the same kind of experience that they would have gotten if they had continued there? So I'm always optimistic, but as you have suggested, Doc, like we got to start thinking about ways of creating a model so we can like not let these types of things happen. And I don't know, with the current model where you can have these large corporations, these investors come in and kind of do what they did at Southwest. If you think about it, if I'm a large investor and I want to, invest in an airline like Southwest, right? I'm going to invest, and then I'm going to say my priorities have now shifted. Now, when I flew Southwest, you would get entertainment, you would not be charged for bags, and all of the things that made them, and they give you a nice value proposition too. But when it's taken over, sometimes the priorities shift.
Yeah.
That shift prioritizes money over people.
Right.
And that's what happens to hospitals. Again, I don't know all the details of West Suburban, but when large entities take over, when you prioritize profit, and at times what happens is they go in and they shift the priorities, and then sometimes they get a loan and they do things that may make it good for the investor for today, but they don't think long term. In fact, a lot of these great companies that have come and gone, that's why they came and went, because it wasn't a long-term strategy. It was about how can I make profit today, and then I can sell the company to another investor who has the same mindset, right? So ultimately, you strip away the principles, the foundation, and when you do that, you are then finding yourself in situations like this, and so some of the fixing has to do with what we allow to happen. So I'm not suggesting we can stop corporate takeovers, but we do need to create a model where some basic infrastructure is put in place so that there's a way to protect the longer term interests. And so I need to hear a plan. What's the plan for the longer term interests of this hospital if I am in a position to acquire it? And it has to be a plan that serves the community. You could argue, and it shouldn't be a difficult argument, that there's no difference between the fire department, the police department, and the hospital. So you could argue, why is this even allowed to be private in the first place? You know, you could argue that the model that they have in other countries, where is a need that has to be met. Therefore, we will not allow our farmers to go, you know, broke. We need to have food, right? So there's certain things that should not.
I would argue differently.
Yeah,
I
well,
would argue differently. We live in a capitalist society and business rules. And so there's a different approach to medicine when you actually have a philosophy that talks about capitalism, and capitalism is king. So, you know, there's a whole different approach. And Dr. Mason talks about it all the time. You know, that people are chasing the money in medicine. And the way you make money is you look and you reduce your costs, whatever they may be. You reduce your overhead. You continue to provide a service, but you make sure that the margins are such that you make a profit, particularly a profit for the people that are not doing anything other than putting the money in there. One of my best friends is a venture capitalist. He and his business partner own the largest network of assisted living facilities in the country. That's what they specialize.
But the problem, have you been?
He's done very well.
Those facilities. That's the whole point. When my wife's dad was in a nursing home that was for profit, I think it diminishes the care, because one thing I saw clearly is that the staff was underpaid, the staff was overworked, and because the incentive was profit, they could care less about those employees. All they cared about was, am I making money? And so the system.
But Tony, that's my point.
Yeah.
Once that is in charge and they control the money and they're buying the hospitals.
Yeah.
The philosophy is, how much money can we make? And what do we actually have to do? Patient care is not what they do. You went into medicine to be a doctor and to serve people and to heal people. That's a different approach. They went to business school to learn how to make money. And even if they didn't, they know that there's an opportunity to become richer in this area.
Yeah, I think you guys are saying that. I think you guys are arguing the same point, but you're stating it differently, in the sense that healthcare, because of the nature and the necessity of it, has to be first concern has to be for the sick people and or preventing the people from getting sick. You're making money is fine, but that, in terms of what the facility means to the community, it means that, it has to deliver that care. And I mean, we can say, well, you got to deliver it at the most efficient cost. Well, they're actually doing the same things and using the same kind of facilities. And so I think that that's part of the problem, is the facility themselves are old. They're being the model themselves, even new hospitals, they're big places, and in every hospital is a big place with a lot of overhead. And so, Dr. Hampton was talking about down Mississippi. I mean, because the rural area hospital have the same issues as the small hospital in Chicago, is that they don't have enough money, they don't have enough patients, so they have difficulty paying the bills, and so they're shutting down. Now they shut down services, and so when people need that service, they can't, it's just not there, and so you got to travel. And I remember back when I was in practice, and I had some patients that were from some from Mississippi and some of the other southern states, and they always said, when I get close to retiring, or when I retire, I'm going back to where I grew up at. And some of my patients, they did move, and within a year, they called and got an appointment, and they were disappointed because they were used to Chicago medicine being practiced the same way as it was in Chicago, and that you could get to care relatively easy. You have to travel there because hospitals are not, right around the corner. And so, a couple of them actually changed their plan and say, I really wanted to live there, but I have some healthcare issues, and I need to be certain that's my priority, and I can't, the other things that I like become less of a a priority now, that because my health care is more. And so I think that so those are the things that how do you do that? And like maybe every hospital doesn't need to provide everything. You know what I mean? Every hospital doesn't, but you do need hospital where when people are having emergent events, that those things can be handled in a timely way. And if the patient ended up being that they need to have an ICU care, that you can have that kind of facility, which may not have to be a big hospital, but it can be a small facility that provide those necessary things. And if the patient needs something that's going to be longer term, that you can then maybe move that person to a different facility. But I think that's something, I think that we just got to figure out how we can do this differently, because these hospitals are they're on the verge of closing. They just can't.
Yeah. It depends. You got big systems now, and you have academic medical centers, but you have a lot of small community-based hospitals. They're struggling. My first job in a hospital was at the University of Illinois. I was the business manager for GI. At that time, this was in the early 90s, and I've told people this before, 83% of all the physicians' revenue came from cardiology, 50%, and GI, 33%. If you don't have surgical subspecialties in your hospital, you can have all the doctors you want. You can do everything you want, but you're going to lose. You're not going to make any money. Yeah. What the surgical subspecialties do is two things. One, they bring people to the hospital because everything they need to do, they got to go inside. They got to look at people. So there's money in specialty care. Community hospitals don't do specialty care, and so there's no real money there. And that if you look at the University of Illinois and you look at the numbers of doctors that are there and the income that's being generated, there's a disproportionate balance when 83% is coming from 2 units. What kind of money is the other 17% bringing in? They're not bringing money into the hospital. They don't bring patients to the hospital. They see patients at the hospital. These equations are what don't work. We're also in a capitalist society. Some of the places in Europe, they're socialists. Their systems work because there's a different approach, and the approach is focused on the people. And so in the United States, it's about the money, it's about business, and now the venture capital has got a foothold because they're looking for wherever they can make money. And healthcare is one. They don't care what happens. That's not their issue. That's somebody else's issue. That's the doctor's issue.
But people die.
That's because
my friend, and this is what I heard about capitalism. Their equity in what they own is worth the company alone. They can't lose money. Right. They own property.
But that's what I'm saying. So when people don't,
all of that is fungible and is worth money. So they've made a calculation that they can't lose no matter what. Because if I lose, I can sell all this and get back most of my money. He told me
that when we think about healthcare, though, we got to think about there's something that seemingly has to mean more than the money. Affordability of healthcare. I mean, there's some people who are on Medicaid and Medicare who don't have, and there's some people who don't have anything, or they get sick, they go into the hospital. And if your interest is making money, you don't really want to serve those people, but they do need care. And so, as a society, we have to, be compassionate and caring enough that we make some kind of provision for those that do not have. Otherwise, I understand, the capitalistic and the whole thing, but we have to also make provision for. We realize that there are those that have and those that have not.
That's right.
And we must make certain, that those that have not is able to get the needed care that they need, regardless of what their financial situation is. If someone has a stroke and don't have any money, what do they do? You know,
Yeah,
this.
but what you're talking about ethics and morals. And
Yeah.
that's a different. That's a whole different kind of
Well,
thing.
that has to be an
If you're
important
talking to
thing.
somebody
You know?
specific, so I can't make money that way. That ain't gonna pay my bills. It's a nice thing for you to say.
Well,
Yeah,
let me,
well,
let
no
me,
money
let me
in that.
interject because I think, like, I remember I had about 5 or 6 properties in the city on the west side, and during that time, my tax burden was greatly reduced. Now, does Dr. Hampton really need to have a reduced tax burden? I would argue the answer is no. So it is a philosophy that we're willing to tolerate. So let's talk about, like, if we settle for the standard or the norm is that capitalism rules. Although we still have socialism, we have Social Security, Medicare, we got police, we do have socialism in our country. The question is our traditional way of thinking, particularly in politics, has been very, lobbyist driven, corporate, and that traditional way of thinking does not have to remain the way we think. And the people who's going to make a difference are not the politicians who are kind of stuck in a broken system. It's going to be grassroots efforts. And if I were to use our mayor in New York as an example, he's not a perfect man, but he's a very skilled politician who has engaged the corporate folk by saying, we want your business here, but we're not going to allow you to exploit workers and the tenants and the consumers who are in New York. He decided, you know what? Affordability is an important issue. So let's work together as business and person who needs those housing things to be able to achieve that, and he's welcoming investment. But this is the thing: in order to make these things true, you have to be skilled, because the rest of the world is like, how dare you come in here and disrupt our system? And I say, how dare you treat my people the way you've been treating them? So I'm going to fight until I'm in my grave for people to have the things that I have with my current lifestyle. And I don't think we have to settle, because if we settle, then what's the heck? Why even have this conversation?
Yeah.
I think that there are many opportunities for us to allow corporations to. We should not live in a country where Bezos, Elon Musk could literally live off their loans off a stock purchase, the stocks they have, and not pay taxes. That should not be allowed in this country. We could take 10% of Elon Musk's money and have universal health care. So until we stop being prisoners of this Citizens United lobbyist model,
Yeah.
we will continue to have the level of poverty that we currently have. And we can't settle and say, well, this is capitalism. I enjoy capitalism. I have a YouTube channel. I want to be a capitalist, but I'm also not going to sell my soul and allow the person down the street to starve to death so I can make an extra buck on YouTube. I just can't. So is the world. So I think that there's enough good people who care about their neighbors, who's willing to fight, even in a system that we're going to have to struggle to fight within. I mean, even in my health system, we have a president. I'm sorry, a CEO, Gene Wood, Health, Hope, and Healing book, which basically talks about equity, which talks about helping people. You don't hear from a large corporate entity that they will write a book like that. And by the way, here's $1 billion for the South Side of Chicago. Now, why is that important? Because I want people on the South Side to be successful so that I can have a business on the South Side that'll be successful. That's good for business. We can't have everybody struggling and having to rob their neighbor because they don't have opportunities for jobs, or they don't have, a grocery store to go to, which is what they're trying to do in New York, or don't have transportation, or don't feel safe. This is going to help everybody, but what we can't allow is greed to rule this conversation. Absolutely. If we allow greed, how much money do you really need? Do I really, as a doctor, how much money do I need? it's almost ridiculous to assume that more is better.
Mm.
And I would argue that those people with those billions and billions and billions, millions, I think that if they were a little bit more understanding of their neighbors, I mean, we would bow down to them and say, thank you so much for helping us get universal health care or college free.
The operative word is if. Elon Musk doesn't give a damn. That's the bottom line. Jeff Bezos cares, but it's not his problem. So that's other people's problem. I got mine. And
but we don't need them. We need courageous people. We need people like the guy in New York. We need more. That's why you're starting to
work in government. Government doesn't always work. Even the mayor can't get shit done. I know,
but he is. That's my point. But he is within. I don't know how long he's been in that role, but within a few months, he's gotten things done. We can't assume that because we've had.
What do you think he's got done? He's talked about things. What has he gotten done?
Are you kidding me? I mean, I can Google it right now. But he's. Let me watch this. Watch this. Share the things that the mayor has achieved. Just give me a second.
Joseph,
he's on the news almost every other week talking about what he's. So let's just do a little quick search, because listen, I'm not a guy that's in politics per se, but I got common sense. So far, he's frozen the rents for approximately 1 million apartments so far. He's expanded affordable childcare, 2,000 free full-day seats for 2 euros, 1,000 additional 3K seats, and he plans to expand the state-supported program to 10,000 children. He expanded reduced price public transportation. He balanced the city's budget without broad service cuts or property tax increases. He increased investments in housing, 22 billion to be exact. He strengthened tenant, worker, and consumer protections. He did that in his first 100 days. He presided over, I guess their crime had fallen since he's been mayor. He improved basic city operations and public engagement, whatever that means. He created new educational and wealth-building investment. But the bottom line is that I don't know. He hasn't been there that long. But those are things that he's haven't achieved anything.
If you ask New Yorkers how much better, that's a subjective thing. How much better do they feel safe?
But I gave you objective. I gave you objective stuff.
No, you didn't. You read me what people said.
No. This is. Wait a minute. Slow down. What I just gave you. If I tell you that crime fell in New York, that's not subjective. That's facts. If I say that he created,
how did he cause crime?
He froze rents. Now I can't give you the details. I'm just saying let's do I gave you the high level. He froze rents, right? On June 25th, last month, the Rent Guidelines Board approved a 0% increase for both 1 and 2 year leases, covering roughly 1 million rent subsidized homes. Now, do you think those people are disappointed that their rents are frozen, or do you think they're happy? Now, how that affects?
I don't know. I don't know.
That's my point.
That's what he said. It takes time for things to be put into place and to actually happen and to actually have some effect. Those are all good things. Whether or not they've been transformative for New York, you won't know for months, if not years.
And I'm okay with that. All I know is that he did.
But I'm not arguing the point. I'm saying you can't tell me that that's changed things because there's not enough time.
We have a choice. We have a choice. We can have leaders who talk the talk, and we can have leaders that walk the walk. And what I'm saying is, I followed that election because I'm.
Have you ever worked in government?
Pardon?
Have you ever worked in government? Have you worked in government?
I don't have to have worked in. That's just like saying
I just asked
to a pediatrician, have you ever had kids? You can still be a good pediatrician without having kids. You can read, learn, you know what I mean? You can't use that argument about I value and respect your knowledge, but what I'm saying is that sometimes you need fresh ears and fresh eyes with a different perspective. You know, the person who changed our health system the most was a guy who was the vice president for Advocate Operating System when I was the medical director. He was from Nike. You don't have to be in an industry. You just have to understand principles and have values and are interested in making change. And that's all you need. We have had presidents who have never been in government and became presidents and were effective. So I don't like that argument because it doesn't honor the fact that the people who are currently in those positions ain't doing nothing.
Yeah.
So I need somebody who.
But you're also, if you're basing things on principles and values, you also have to acknowledge some people have no principles and have no values. That's all I'm saying. There's a whole element out there that don't give a damn.
My job
and they
is
got
to have
money.
a lot of voice.
They got big
I have to have a lot
but
of
I don't
voice.
know what Nikki wants us to do because we're
those are the problems of our society. The folks that have no principle, who have control of everything.
Oh yeah.
And so the masses go by the wayside and they suffer. And so when we look at it, we look at what one of the mayor or any particular individual has done. You know, maybe he hasn't done as much for those that are rich and really don't need a lot done. But the mass of people need some things done. And so my thing is simply this: in terms of hospital, though, back to that, is that we got to figure out how do we deliver. And this is, it's not about making money. How can we, in a efficient and effective way, deliver care? And part of that is doing things before the patient gets sick. Mm-hmm. The system itself, and this is where being in a private enterprise doesn't help that, because it takes someone who has a long-term interest that they will benefit by keeping people healthy, making certain that people have the needed things that can keep them healthy, the food that they need, as opposed to not having that and then making do with food that is really going to cause harm to their body. So prevention has to be is really, if we talk about lowering health costs, the only way that we're going to do that is by preventing some of these diseases. As long as disease is rampant, not checked, and we don't have ways to improve that, people are going to suffer, and that's going to cost. When a person gets sick and has to go into the hospital, that 1 or 2 days that they're there is probably worth a year of outpatient care, delivering good quality outpatient care, where the people are being taught and the necessary time is dedicated, so that the individuals that may not understand certain things is getting to ask that question. And so what I'm saying is that if we really want to lower costs, we got to work it out. How do we lower costs? You're not going to lower it by being more efficient by denying the care that people need. No, you got to do the things that prevent people from getting sick. That's the only thing that's going to keep down the cost of healthcare. And so that means people are eating correct. People have facilities and they feel safe to be able to exercise. That people are being taught, what they need to do, and we're spending time and resources made available so that people can get those things. And now, if we prevent certain things and then we manage certain things, I mean, just looking at, for instance, someone has hypertension, but they're not accustomed to going to doctors. They don't know they have it. And so what happens is, maybe by the time that some of these people find out, the first time they know they had hypertension is when they have a stroke. Now, they might have been going on for years, but now the cost of healthcare is really finna really skyrocket for that individual, because he's going to need some things, and then he may not be able to work and provide for his family. So now he's going to need to be on disability. So there's another flow of money that, had he been healthy, not had a stroke, that cost would have been less, and he would have been receiving less. He would have been less of a burden on society and been better able to take care of himself. So I think that we have to think about those things in terms of the long term. Now, the person who's interested in making money is not interested in that. They're interested in how much can I get and how fast I can get it. But if it's my responsibility over the long haul, that regardless of what happened, the load is going to fall on me, then I begin to think in terms of long term. Now, what can I do to eliminate some of these rising costs? And I think that we've had on this this forum, and just in other forums, that we've had discussion of how do we keep people healthy? How do we keep people from having to go to hospital? We talk about making certain that people have primary care doctor, make sure that people get the screening, make sure that. So what I'm saying is that we might need to invest more money into those kinds of things, and then we can see that result. Now, it's not going to work in a year. It's going to take time. but we have to start that process. And if we want to get to that kind of end, and if we really want to lower the cost, because all the other things are not going to lower the cost of healthcare, just going to continue to rise. And if you look in, over, how things have gone up in terms of, I mean, everything has gone up, but healthcare has really skyrocketed, and it's not going to get better because until we started being more active with overall prevention for everybody that we can reach, everybody that we can involve ourselves in. And sometimes the investment is worth it if we just have to go out to people's houses or whatever to pay someone to do that, to make certain that people are being monitored, that people are being given necessary resources and assistance that they need in order to prevent them from getting some of these problems, or if they get it, that it's treated. If you got hypertension and the blood pressure is controlled, or they're doing the things that lower their high blood pressure in terms of their diet and those things, overall, in the long-term effect is that they are going to pay less money for healthcare than the opposite if they didn't get that. So I think that we have to begin to look at how do we do that, because that's what it's going to take to change that process. Otherwise, the cost will continue to rise, and people will not be able to afford it. And people who don't have, there's nothing that they can do. So I think that we need to reimagine this whole process of what it is to deliver healthcare. We talk about this a lot. Healthcare, not health monitoring, not treating diseases, but treating people, keeping them healthy, so that they don't get these points that they're sick, and the first time they show up in a doctor's office or get medical attention is that they done had a heart attack or a stroke. Now, the cost to take care of that person the remainder of their life is going to be, just a huge cost. And so that's what I'm saying. We got to look at ways. How do we prevent these things? They're preventable. They're workable. They're doable. But it does take that investment up front. We need to, maybe we need to also, begin to make certain that in our school system that we teach health again, that people learn that and they grow up with these ideas and understanding, and they're in a better position to know what to do. But if you don't know and nobody's teaching you, how can I know if nobody teaches me? And that's just part of the failure here is that the system is not really, and as you said, maybe part of it is because the system has been to make money, like for somebody to make money. They're happy to provide the greatest services as long as they're getting plenty of money. But the problem is a lot of people, the majority of the people, don't have that kind of money. So what do? Ultimately, somebody got to pay, and the cost is going to fall on everybody.
Absolutely. And with that being said, we got to say hey to some people. So I want to say hey to the guys in the garage. I want to say hello to the Black Fire Brigade. Also want to say hey to Laura Leon. She says, good evening, doctors. Regina Tyler says, I'm watching. Sendo Scott is here. She says, hello. Connie Taylor is here. And she says, good evening, everyone. Nellie Purnell King is here. And she says, good evening to everyone as well. Dorothy Murphy is here. She says hello to Allinger is here, and she says good evening to everyone. Want to say hey to the president of the Metropolitan Water Reclamation. That's our own very Carrie Steele, who is here with us. And want to also say hey to Pat Dow, who was here just as well, and she sent a little hey via text message. So I want to say hey to her just as well. Renelle on the go is here, and she says this is a great conversation. So I want to say hey to her just as well. So you are absolutely right. We have to look at our cost of healthcare. We also have to look at the cost of everything that is going on. And the fact that, I must agree, we have to have people who are caring, loving, and just basically someone who has a heart. And that's what's most important. You got to have a heart. I have never found out that there are so many people who are heartless. I don't know how they're actually alive because they don't have a heart. And I did not know that so many people had such an interesting relationship with the truth. That is another one that gets me. Their relationship with the truth is so interesting. With that being said, Tony, I want to commend you for actually bringing up what happened in New York and talking about that mayor and what he has done. True enough, the wheels in government do turn slowly, but as the congressman would say, there is always hope. And one of the reasons why we have such low voter turnout is because people think their vote doesn't count. People think that there is no hope. So when you see these little small changes that are happening, it tells us that there is hope. And hopefully, Senator Warnock actually shared that. When things happen where he's at and they were trying to do some Willy Wonka messy stuff with an election, hope sprung eternal. And people came out of their houses that had not voted in a long time because of some very little things that he had done, even though you had not seen all of the benefits from it. It was there. The hope was there. So we want to continue the hope because that is most important. And, if COVID didn't teach us anything, one thing COVID taught us is that there was a small Band-Aid across a gaping wound that needed tons of attention. It also brought out the fact of all of the racism that's here. I mean, people hate to talk about it. You think it's just going to go away, and it is not. So hopefully this gives us the opportunity to band together. We have to begin to everybody's depending on social media to do so many things. And yes, it's a tool that helps. But we really have to continue to have those kitchen conversations that our parents and grandparents used to have. Mm-hmm. There was never a time when we really, really used the emergency room as our primary care physician. And it seems like now that's all we do. That's one of the reasons why we have this couch conversations to let people know, hey, here are some doctors who take their free time to share information with you. And guess what? You can actually go and see these doctors. You can see them, and you can see them in a space where it is not an emergency room, and you can create a relationship, which is what really saves your life. An emergency room is just that. It's an emergency room to fix an urgent issue, if they can, because sometimes your issues have gotten so out of line till they can't fix it. And we are here to actually tell you that things are fixable and that if you create these relationships, you can. When we talk about healthcare and healthcare expenses, I want to go back to just a few things that we need to look at. Sometimes we get fooled by Big Pharma. I'll give you a prime example. One, there is a wonderful cure out here for sickle cell, right?
Yeah.
Look at the population of people that sickle cell affects, right? Now, to know that the cure costs a little over $2 million, who can actually get the cure? I want that to marinate for a little while. And the congressman is diligently working on that. It's here, but it costs a little over $2 million. So, of course, Medicaid or Medicare is not paying for that right now. So who actually gets it? What makes no sense to me is you want to charge $2 million for the cure, right? But you spend over $2 million in hospitalizations when those children have to come to the doctor, and you do that in less than 6 months, especially if they spend some time in ICU, especially with some medication, and then their little bitty tiny bodies begin to debilitate, right?
Yeah.
Now, I'll bring it home a little bit more. Just recently, Wegovy came out with a pill. They promised all people who are on Medicare that they only had to pay $50. They put millions of dollars into commercials talking about, you can get this pill and all you got to pay is $50. Download our coupon, take it to the pharmacy with you. The pharmacy got flooded with these coupons this weekend. And I have a colleague in my office who called me and was like, why did they charge me $225? When it was only supposed to be $50.
Yeah.
Fine print is important.
That's what they did.
And she's a senior. And she has all these comorbidities, and her doctor put her on it. But between Blue Cross Blue Shield and the pharmacy, they asked her for $225. So this is where advocacy comes in at. Because Blue Cross Blue Shield is still saying that this is a tier 3 drug. Yeah, we're willing to pay something on it, but it's still a tier 3 drug. So your coupon is only going to take off $25. You still got to come up with this. So we have to look at things a little deeper, and we have to continue to advocate. Now, if everybody take that medicine back and say we ain't gonna buy it, I promise you it's gonna be $50 because they gonna need to sell it. So we have to look at things from a different perspective. We have to look at things from a different perspective. I would rather, everyone else is winning except for us. And here's what I mean by that. People will carry a $5,000 designer bag and only have $50 in the bag. Right? So you got a $5,000 designer bag and trust and believe you look fabulous. But you have $50, maybe $5 in the bag. You have nothing in the bag to actually move forward in life. So guess who's winning? Whoever that designer was where you bought that bag from, they're winning.
Right.
You walking around here with $300. My cousin, my cousin told me, I told him if he got straight A's, I would buy him these gym shoes he wanted. He told me about I don't wear gym shoes. So clearly I did not know. So he took me to the Nike store to get his gym shoes. Mind you, he is a ball player at a Catholic high school, and he's tall. And when they brought that size 14.5 shoe to him, and he tried it on, and he walked around, and he was looking like, look at him, look how beautiful they look on my feet. I'm like, okay, take them to the register. You did everything I asked you to do. When that man told me $425, I was like, wait, I'm sorry, baby, okay.
What?
I was like, these gym shoes, these are gonna have to be community gym shoes. We need to call some other family members. They need to sell me $100 right now. I mean, I said, okay, $100, $150, $425. So the designer person is winning, Nike's winning, all these other designers are winning, except for us.
Yeah.
We have to win. And we have to win in healthcare. When you go to the emergency room as your primary care physician, you are not winning.
Not winning. That's true.
Our FQHCs are going underutilized. Our departments of public health are going underutilized because we are not paying attention to the information that's out there, and we are not winning.
Yeah.
We are not winning when we have a new case of an HIV positive. Too much information out here. We're not winning. We are not winning when we have high levels of breast cancer. We are not winning because we are not paying attention. There are so many studies that's talking about diabetes. Dementia is a form of diabetes type 3. We're not winning because no one's paying attention. When are we going to pay attention? Paying attention starts in those kitchen conversations. When you and for those of you trying to act like you don't have kitchen conversations, okay, well, my family, we had backyard conversations when everybody in the backyard playing dominoes and spades and what's the other game, Dr. Miller, that they play in cards? Bid-Whist. When you sitting there playing those games, you not winning. Switch the conversation. If you have not had a CBC and a metabolic panel, you should not be able to play cards until you get it. You want to win? Bring your numbers to the game so you can win. What's your A1C? We need to begin to ask these questions. Don't be afraid to ask your dad, your brother, your uncle. Did you get your prostate checked? I asked every man I knew in June. June is Men's Health Month. Yeah. Did you go get your prostate checked? That was oh girl, you asking me about my private parts. That is not your private part. It's a prostate. Did you get your prostate checked? In November, I asked everybody. Matter of fact, you will see a post from me today. I went and got my mammogram. It was my time. I'm going to put those little stickers that they have you put on 1 and 2 and put them up here and say, did you get your mammogram? That's a form of our kitchen conversation so we can save each other's life.
Yeah.
It's nothing nasty about it. This is human fact. This is human life. And this is why we are leaving here. Look at the almost pandemic we're dealing with right now today. All over the news today and 50 meetings about it. Our measles is about to get out of control in our city. What are we doing about it? Are we talking about it? Are we educating our community about this measles vaccine that's out here, a breakout that's out here? Are we talking about it? Are we explaining to anyone who was born between 1969 and above, in the early 60s, that you may have to go get a test and get your titer checked to make sure you still have some MMR in your system? Are we having those conversations? And do we know that your grandma at home or your mother or father, which may have comorbidities, and if you bring a baby in the house that has the measles and they catch it, we're going to have an even bigger problem? We have to break this down. We're not winning because we're not paying attention. So Mary Ballinger says, indeed, Nikki. And she also says, tell the truth. So that was my soapbox for the evening. You guys go right ahead. But Tony, I commend you because there is hope. And hope springs abroad. We have to have hope. If we have no hope and see no hope, then there's a problem. The reason why we have so many people in government that have an interesting relationship with the truth is because we don't vote, or we voted for them. And when we found out that they had an interesting relationship with the truth, we should not vote for them again because they don't care.
That's right.
Yeah.
Absolutely. Let me say this in terms of, you know, I'll help people with hope just briefly. So we have Advocate Healthcare where I work, and we are considered what they call a population health organization. And all that means is that we don't focus on just treating individual illnesses. We are proactively trying to manage the entire person and their care. So when I speak about $1 billion for the South Side, the first thing people fuss about is, well, why are you building a hospital with less beds than a current hospital? It doesn't make sense, right? Because it's going to be Advocate Trinity Hospital with less beds than the current Advocate Hospital. Shouldn't you build a hospital that's bigger? Well, that $1 billion is also going towards 10 clinics that feed it. Those clinics' job is to keep people out of the hospital. So, and then we have a metabolic model, because poor metabolic health, and for the naive, that just means your blood pressure is too high, your blood sugar is too high, your belly is too big, your triglycerides and HDL, those things in your cholesterol panel are not normal. So only 7% of Americans are not metabolically healthy. So we're going to have clinics that will help people achieve metabolic health. By the way, you don't achieve metabolic health by being on a statin or metformin. You achieve it with lifestyle changes. So we're going to have people to support that model. And my point is this: a large population health organization has a completely different perspective, which has colored who I am. If I was in a more fee-for-service model, I would only focus on how much do I get paid to do this procedure. If I'm in a model like Advocate, where we get paid more money to keep you healthy, that is a model you see in other countries, and we're certainly not where we need to be. But that model provides the foundation for what we've already been able to achieve. If you just Google how much money did Advocate Healthcare save CMS over the since 2012, I noticed at the top of my head, because I'm in those meetings, it's about $900 million. Now, that may not sound like a lot of money if you're thinking about the economy of the country and the economy of Amazon and all that. But ultimately, we have shown that you can save money by keeping people healthy. We're the third largest. I know Kaiser Permanente is the largest population health organization, but I think we're in third place. And to me, that's a model that will allow people to model themselves. So one of the things I'm involved in, I helped start the food pharmacy where we give out food. And now we have at Advocate Good Shepherd Hospital, we have a smart farm. And so now we're growing food. We have 9 farmers on our staff and on our payroll, and we're growing food then feed to the food pharmacy. And now we're going to do research around that model because we have to prove that it works. We have to prove that it actually improves the health of the people who are receiving that care. And if that model is working, we can then go back to CMS and the government and say, hey, we can actually save you guys money, but we need money to help fund, having coaches and being able to help partner with organizations to help buy this food, et cetera. So so yes, is it altruistic and not the current model? 100% true. But if people start to heal and learn that they can heal with their fork and maybe by movement and reducing stress, as opposed to give me another prescription, it'll then be the grassroots movement that'll say we need more people who are going to support that. And that's how we end up with leaders like the guy in New York and other places where they say, you know what, I hear you. And although the lobbyists have been knocking down my doors, I'm going to just listen to you today. And then then we're going to try to pilot programs that'll help people. I do not want this country to turn into a country where we are not able to take a brain that comes up with an idea and they can turn that into something. I mean, I use AI every day. I want to live in a world where people can invent stuff like that, right? And I know that this country is better at that because of that capitalistic mindset. But never should these things be bigger than the simple ideal of taking care of your neighbor. I think you can do both. Me being a compassionate, empathetic doctor has not changed the car I drive outside, has not changed the house I live in. It's still pretty good, but I'm still able to do both. We can do two things at once.
Yeah. We can multitask. That's what multitasking is. But one thing I don't want to do is I don't want to see a AI physician.
Yeah.
And that's what's happening. That's what's
be too late.
That's what's happening. No, you're right, Joe, because that's what's happening on a certain platform that I will not mention their name, but they have AI physicians.
That's crazy.
That you are seeing. They're asking you to do telemedicine with an AI physician, and then that AI physician, when they have a question, the doctor that they have on staff is a veterinarian. I'm gonna leave that right there and let y'all marinate on that too.
This happened to you? This happened to you? Really?
Oh, no. No, it didn't happen to me directly.
Oh, okay.
But this is brought to our attention. Woo. So no. And the person that the doctor, it's a veterinarian. So I'm taken back over there just as well. This is why we have to be careful of what we're doing.
Yeah.
Oh, go ahead, Joe.
I want to talk about one of my roles.
But Joe, right before you talk about one of your roles, let me say this really, really quickly. Okay. CDPH got a new director today, the new commissioner of Chicago Department of Public Health, and I'm going to support him. And here is why. There is one thing that is constantly talked about. One, I believe in public health and how important it is. So I'm going to support whatever it is that he needs. But there was one administration that the Chicago Department of Public Health had, and that was Dr. Terry Mason and Joe Harrington. During that administration, and people still talk about that administration, and here is why. Not only did that administration do the necessary paperwork and things that needed to be done, they had a great relationship with the truth, they had heart, and they also had a great relationship with community. People are still asking. You know, Dr. Mason went into local beauty and barber shops to teach them about breast cancer. He came up with these steps of what you could do. He did not leave the small man out or the local business or the mom and pop shop. And I believe we need to get back to that so we can continue to save people's lives. It is 2026. There is no way that babies should be born with syphilis today. And they are. And that number is on the uprise. And they're blaming it on COVID. But I am blaming it on lack of education and underserving communities, disparities, and also not being aware. And that's one of the jobs of the public health department. And I believe this new commissioner is going to do a wonderful job. And whatever he needs from our office to help support him along the way, I know we'll be there. Go right ahead, Joe.
Yeah, well, I mean, there are a lot of things going through my mind because it's been a rapid fire conversation. but I'll start with Garth because I'm pretty sure Tony knows him, and he was a physician at the University of Chicago. Still probably has privileges at the University of Chicago. He went to Rush. He was also the director of men's health for the state health department for a time. So he knows what he's doing. He's very competent. He's very personable. And I think we have a winner in terms of Garth being there. And he's sensitive to the needs of community. And I think people will find him, not that Dr. Olasimbo was not the same, but they'll find a welcome person, somebody that really will do the best they can. But again, it gets back to, remember, and I've worked in government, so it's still a public agency and it's part of government, extension of government. So sometimes things are not as easy to do as people might think just because of the bureaucracy. Because I've worked in bureaucracy both at the city and state level, and I've interacted with the federal government, which is like government on steroids. Well, state for me, having left the city, was like government on steroids. I thought there's a lot of bureaucracy in city government. Having worked for the state government, I've seen bureaucracy in a whole nother level. But picking up on that, but then moving on, you'll find bureaucracy anywhere. And Tony can probably attest to this, that Advocate is one of the largest healthcare systems in the country. And sometimes things that seem very easy to do are very difficult to do and accomplish in a large system. So that's one thing that people should understand. And change for them oftentimes is very hard to do. It's almost like being at the helm of the Titanic and seeing an iceberg and know you don't have enough time to stop and change course. You got to figure out what you can do in an instant. But all that said, I'm going to talk about Cook County Health because I'm on the board of Cook County Health. And like Tony has talked about Advocate, Cook County Health is a lot larger than people may think. That we operate more than one hospital because people think about the county. We also operate Provident Hospital. So we have two hospitals, not just one. Cook County also provides all the services to the county jail. People in the county jail need health services. People in the juvenile detention center in Cook County need health care. We have a public health department. And we operate the largest Medicaid managed care program in the state. So we actually pay for people's health. And we have close to 400,000 members in our managed care program. So we get a chance to see healthcare in a way that people don't always do. But what's really important is we operate out of a mission. And our mission is to provide universal access to top tier care and health service for all county residents, regardless of the ability to pay. So when you talk about safety nets, the county is the biggest safety net. And any impact on safety net hospitals are going to have a significant impact upon us. But it doesn't change our mission and our drive to make sure that everybody in the county of Cook and everybody comes through our doors not only gets the best care, but we want to make sure that people remain and stay healthy. And we want to do everything we can to do that. A couple of more things. One, I want to talk about what we've sort of talked about in applied sense, which has a name in public health, the social determinants of health. And we talk about this a lot, but we don't talk about it maybe from a technical standpoint, because ultimately when we're talking about that, one of the things that a lot of us talk about is your zip code is more important than your genetic code to determine your health outcome. Because where you live determines, maybe how much you earn or what kind of job you can get, or if you work or if you can't work. It determines the access you have to food. Do you have access to healthy food? Maybe you don't have access to healthy food. So where people live plays a significant role in their health moving forward. And so from a population standpoint, that's one of the things that we really focus on in Cook County Health is we want to make sure that everybody, every individual has the opportunity to reach their fullest potential and lead their healthiest life. That's what we're dedicated to doing. I think Advocate in a certain way is trying to do the same thing. They want people to be healthy. They want people to lead healthy lives, because if they lead healthy lives, there'd be less dependence upon what we do. But also there's a benefit to everyone in us doing that. So the last thing that I'm going to talk about is the idea of hope and change, because we've talked about those two things, which having been to the Obama Center twice, are cornerstone of President Obama's life and career, and also a cornerstone at the Obama Center, because what we're talking about is hope. And if you have no hope, you can't work toward change. And so we have reason to hope because of things that we've seen in the past. And that's what hope is based upon. We've seen things that have been done, that have worked, that have turned into a great benefit. We have to maintain hope, but we also have to be, not only in our individual lives, but in our collective lives, agents of change. So do what you can where you are. Everybody has the ability to do something. Everybody has the ability to pitch in and do something. But together, working together, having some kind of common vision and goal in mind, we can make the city and ultimately the country and possibly the world a better place to live in. And that's a platform.
Outstanding. Outstanding. And to the person who sent me a little note and said, well, what about the other directors of public health systems? Let me be clear. I'm not putting down any director of a public health system. All of the directors of the public health system have been great. I was just announcing that we have a new one and that we should all support them. I did the same thing when Dr. Simbo was here. Girl power. We needed to support her. She was outstanding. When Dr. Nzike was the director of IDPH, I've been knowing her for years, so let's support her. Dr. Hasbrook is phenomenal. Support him. So this is what I'm saying. I'm giving, once again, nuggets of knowledge. There are a number of people out here who may not know. You live in Chicago and don't know that you now have a new commissioner of public health. So now you heard it here today. There's a new commissioner, and support them. That's what I'm saying.
Of the people, by the people, for the people.
There you go. There you go. You know what? This is going to be our last statement of the evening because we are like a few minutes over our time. So Renelle says, this is informative. Would it be possible to have a conversation? I noticed that some of our young adults, I think that's i.e. 18 years old, have high cholesterol. Okay, that's something we can look into. So we have some physicians nodding. That's something we can look into. One great thing that Michelle Obama did when she was our active first lady was when she talked about obesity and healthcare. And it just wasn't about obesity and healthcare and trying to get you to eat right. It's because she knew that other things went along with that. That obesity went along with diabetes, heart disease, hypertension, high cholesterol. So that was just the door opener, but she knew the long term. And that's why she was trying to help our youth and let them know what they needed to do. So with that being said, Joe, you're until next Monday.
Well, I'm just going to pick up on this whole idea of hope and just encourage everybody that's listening and watching this program and remind them, never lose hope, because that is the key for you moving forward. If you lose hope, you won't be able to do things. You won't be able to get things done. And with that, and also I'll echo President Obama's consistent theme of change. Change is possible. We can make change individually and collectively. We can't do anything if we lose hope.
Outstanding, outstanding. Doug, you're until next Monday.
I'm going to continue on the same line, I hope, but from a different direction. This has been a very, very challenging time when there have been so many people who have had such an unusual relationship with the truth. But there have been two rather important federal decisions today by federal judges toward the truth and against the unusual relationship in truth. So I think that pattern and trend is continuing. So while things don't look very good now, in the future, there's the potential for things to be much better. Not to give up, not to say this is what it's going to be, but to think about what we can make it become in the future and have a better relationship with the truth.
Outstanding. Dr. Hampton, you're until next Monday.
For me, I'm grateful that we are talking about hope. I think that hope, if you're going to be honest about it, hope returns when people see change happening. It's not just about making promises. It's about like real effort. It's like, I'm a policy person. I will support a Republican policy as quickly as a Democratic policy, as long as it's the right policy. For example, Kennedy, when he changed the food pyramid, I support that policy. So I think we have to be careful not to get so political that we can't see what's in front of us. So we have to invest in our hospitals. We have to protect our hospitals. We have to invest in our children, which is what they're trying to do in New York. We have to invest in our transportation. And we have to invest in prevention, which is what I'm trying to do in our health system. So when we invest in policies that support people and solutions that support people, then people will start to believe in us again. And even as we spend $1 billion on the south side of Chicago, people are so like unbelieving of what we're doing. We have to spend just as much energy convincing people that we're not trying to scam them or be shysty. But what we're going to do for sure is we're going to keep moving forward with that vision. And over time, they will feel more willing to receive us. But what we can't do is give up and give up on hope. So I'm really grateful that we have people in the world who actually focus on people and not just money. So, and all we need is to support though. If you see somebody in front of you, whether it's in your community, in government, even in healthcare, I want you to lean into those people, because those are the people that's going to make this world a better place. But it really requires all of us to do that. So until next Monday, keep hope in your heart.
Tony, that's because y'all should have spent that $1 billion on the West Side. That's all I'm saying.
Whoa.
I believe that right there. West Side, I'm right there.
That's fair. I tried.
Oh my goodness. Well, two quick announcements really quickly. One, don't forget Congressman Davis's Father's Day event this weekend coming up. We will post additional information about that. We'll have vendors and great resources outside, so don't forget that. Also, our back to school picnic, parade, and World Health Day, August 15th. Make sure you mark your calendars. If you want to be a vendor for that, please make sure you inbox me so I can send you that information. And tonight, I'm going to say the same thing. I'm just going to use a different name. Usually, the congressman always takes us home. But because he is traveling this evening on his way back to D.C. and couldn't be here, he's giving that mantle tonight to Dr. Miller. So, Dr. Miller, take us home.
Well, one of the things that, this conversation that we've had points out several things. First of all, it's important that we care and love one another. We're living in a time when it seems like we're more divided and less concerned for each other. This is a time when we need that more than ever, people to be concerned and caring. People will respond if they feel that it's going to make a difference, if it's going to make things better You know, we always say that the community, especially the Black community, is very apathetic. Well, their experiences often has been that they don't see things moving in a way to make things better for them. And I think that we have to involve, and we have to get, you know, we can't just always just throw an idea on the community as opposed to going out into the community, letting folks know and making certain that they understand where change is needed and what kind of change is needed and why they are important. And we got to make certain that we begin to do that more, that we make certain that people understand that we love them and we care for them. That's why we want to make change and make changes that is beneficial to everybody and not just to a few that's making money, and those that don't have don't get. So we got to and as a community we got to show that love and that care and that concern. I know it's hard now, but we got to move close back to one of the things that we need to do. I mean, when I was younger, people spoke to each other. People don't speak to each other now. You know, that's a thing. People are, maybe they're afraid of each other. Maybe they, whatever it is, we need to loosen up a little bit because it's not always the strangers. Sometimes people that live next door, 2 doors down, they don't speak to each other. We gotta change that process, and we gotta make certain that we express our concern for one another, that we are concerned for each other. When something happens, check them out, give them a call, find out if everything is okay. Then they know that you're concerned about me, and then that's what brings back the feelings and the relationships that and it's that loving relationship. If people love each other and care for one another, they don't do things to harm each other as readily. And so we really got to begin to do that as a community and begin to do that in places. And we're too much about the business of what the business is, as opposed to being about the business of care and concern for our people. So that's until next Monday.
Well, Dr. Miller, I thank you so much because the watermelon man is on. And I hope he heard you when you said love one another, because he wanted me to give him $20 for a watermelon. Wow. I think that's too much money. So now, love one another. I'm going to give you $12 for that watermelon tomorrow. I'll see you. Good night.
Good night.